Okay, so there's lots of organisations across Cheshire, and historically those organisations have generally been working to their own priorities within their organisational boundaries. Through the work that we've done around Cheshire Care Record and the development of the Cheshire Digital Leads Group, that group of professionals, both clinically and from an informatics perspective, are working much more cohesively and collectively in terms of looking for opportunities to utilise technology to support care across historic organisational boundaries or limitations. So one of the key drivers for that has been the development of the Cheshire Care Record, which is an integrated digital care record, which is pulling data from 3 acute hospitals, 2 local authorities, about 80 GP practices, a mental health trust, community services, 2 specialist cancer hospitals. That's really been a start point for us, because it's given us a commonality in terms of system and how we're sharing data. How we go forward with that, there's huge opportunities to think just beyond our individual organisations. In terms of how we're doing that, so we've got a digital roadmap. We are also part of the Cheshire and Merseyside STP, and in Cheshire and Wirral we are one local delivery system within that STP. And now there is also a roadmap in Wirral at the moment, and over the next few months we're going to bring those 2 things together. We'll be looking for opportunities in terms of using technology to support new models of care. Also in terms of how we can operate our services more efficiently, so then when clinicians are delivering services in different organisations, then the experience they get from technology is consistent, so that they can go to different organisations and be able to turn on their laptop and connect to the systems if they were in their base organisation. So there's huge opportunities in terms of bringing that together to deliver a much more cohesive infrastructure and set of systems and services to support the clinical service needs. Countess Chester Hospital has got a long track record in terms of using technology to support patient care. So we've had an electronic patient record, sometimes referred to as an EPR, for a number of years now, stretching back to 1999, and we use that extensively right across the hospital. More recently, we've been looking at how we digitise paper. So we've worked with an electronic document management system to bring together all of the paper records that have been created in the hospital into an electronic format. Obviously the benefits of that is it's available right across the hospital 24/7. We're not tracking and hunting for lost case notes. It's always available, and it can be seen by multiple people at the same time. So we've got to the point now in terms of reducing the paper burden in the hospital, whereby 95% of the patients that we see in an outpatient setting, their case notes that are seen in clinic are electronic. Moving forward with that agenda, we've been thinking about how we join up care from outside the hospital, and we've been working to create what we call the Cheshire Care Record, and that's joining up primary care data, mental health data, acute data, community data, social care data, cancer data into a single repository which is available to clinical staff when patients present in any of those organisations. So we've really thought about not just in terms of how we're using technology within the organisation, but also in terms of with our partners right across health and social care across Cheshire. In terms of moving forward, we're really excited about a contract that we've just signed with a company called Teletracking to implement a tracking system. So the hospital has a broad array of assets, be those our staff or our medical devices or our beds, and also obviously our patients that we need to work with. So they're all assets, they're all key aspects of how we deliver service. And the teletracking system is going to give us a capability to start to manage our services in real time. So a big organisation, millions of pounds spent in healthcare in the Countess. At the moment, a lot of the data that we see is we are reacting to, and there can be delays. So even though we've got great systems and lots of technology and lots of data, we're almost always, it's a reactionary response to using that data. Whereas using the teletracking system, it starts to make it real time. So we'll understand exactly what's happening in our beds. We'll know exactly when a bed is available. We're looking at how we can cut out the waste between turnaround times on beds, for example. So when a patient leaves a bed, they will trigger a process through using radio frequency identification tags with sensors, which will alert the bed cleaning team that that person has left the ward, has left the bed, and therefore it is ready to be cleaned and prepared for the next patient. So the bed cleaning team will come in, they will clean the bed space, and then they will trigger another process through a key press, which will alert the coordination team that that bed is now available. The coordination team can see exactly which patients are coming into our organisation that will need a bed, and we can use the needs of the patient plus the availability of the assets within the organisation to match those in real time, helping to reduce unnecessary bed movements, to control and maintain infections, to really utilise the assets that we've got to deliver the best outcomes for our patients. Yeah, so obviously, a key aspect I've talked about already is in terms of beds and utilisation of beds, but it's not just about that. In terms of using the infrared technology and the radio frequency ID technology, we'll be able to track where patients are. So if patients are in places that they're not supposed to be, if they're not where we need them in terms of for a radiology appointment or for a consultation while they're in the hospital, then we'll know exactly where they are and we'll be able to get them where they need to be. We can also use it in terms of monitoring hand washing, so we'll know when our staff have washed their hands and when they are then interacting with patients. We'll be able to understand if a patient's got an infection, what equipment and what people have been in contact with that person, helping us to contain that and manage it as effectively as we can. And also in terms of tracking equipment, so a lot of time is wasted at the moment trying to find equipment in the hospital. So being able to go to a system that knows where you are and where that equipment is and to direct you to it will save a whole lot of chasing around and wasted time for our clinical staff.